Medical conditions to consider before marriage. Warning: before embarking on any medical test for marriage, it is crucial to recognize the sensitive nature of such evaluation and the potential implications they may have on personal relationships. While the intention behind these tests is to assess compatibility and identify potential health risks, it is imperative to approach them with respect, understanding, and an open dialogue between partners. These assessments should never be used as a tool for discrimination or to undermine the essence of love and commitment between two individuals. Caution must be exercised to ensure that these tests are conducted ethically, preserving the fundamental rights and dignity of all parties involved, and that the results are handled with utmost confidentiality and empathy. It is imperative to seek professional advice and consider the implications on privacy, consent, and social implications before making any decisions regarding this matter. In this video, we will explore some essential diseases to consider before marriage, explores the rationale behind premarital medical testing and its potential benefits for couples, and the importance of open communication and health screenings. First, let's consider the communicable diseases. Some of the most important communicable diseases to consider before marriage include: 1. Hepatitis B and C is vital as these infections can have long-term health implications if left untreated. Hepatitis B, in particular, can be transmitted from mother to child during childbirth, underscoring the importance of early detection and appropriate medical management. Unvaccinated partner can also contract the disease. 2. Human immunodeficiency virus (HIV). HIV is the virus that causes AIDS, a condition that severely compromises the immune system. Testing for HIV before marriage is essential not only to safeguard one's health but also to protect the partner from potential transmission. 3. Sexually transmitted infections (STIs) are infections that can be transmitted through sexual contact. Common STIs include HIV, syphilis, gonorrhea, chlamydia, and hepatitis B. Now let's talk about genetic disorders that should be considered before marriage. Genetic disorders are hereditary conditions caused by abnormalities in an individual's DNA. When considering marriage, it is essential to discuss family medical history to identify potential genetic risks, which may include: 1. Sickle cell anemia, an inherited blood disorder that affects the shape of red blood cells, causing pain and organ damage. Genetic testing helps assess the risk of passing the gene to offspring. If both partners are carriers of these conditions, there is a risk of passing them on to their children. 2. Thalassemia, a blood disorder that affects the production of hemoglobin, leading to anemia. Couples who are both carriers of the thalassemia gene should seek genetic counseling before planning to have children together. 3. Cystic fibrosis. Cystic fibrosis is another genetic disorder that affects the lungs and digestive system. Carriers of the gene are typically asymptomatic but can pass the condition to their offspring if both parents are carriers. 4. Thrombophilia refers to a tendency to develop blood clots, which can lead to serious health complications such as deep vein thrombosis or pulmonary embolism. Testing for thrombophilia is particularly relevant if there is a family history of clotting disorders, as it can affect family planning decisions and necessitate special medical care during pregnancy. There are numerous other genetic disorders that can be screened for before marriage. For example, Tay-Sachs disease and others. Couples can consult with healthcare professionals, such as primary care physicians, gynecologists, or genetic counselors, to determine the appropriate tests based on their medical histories, family backgrounds, and risk factors. 3. The third category of condition is mental health. Conditions like depression, anxiety, bipolar disorder, and others can impact a person's life and the lives of those around them. Supporting one another and being aware of potential challenges can foster a strong bond and a supportive environment within the marriage. Mental health is as important as physical health in maintaining a stable and happy marriage. Some mental health conditions have a genetic component and may run in families. Openly discussing any history of mental health issues can promote understanding and support within the relationship. Another very important test to do before marriage is to know the blood type of both partners. Blood type and rhesus factor compatibility. Knowing each partner's blood type and rhesus factor is important, especially if they plan to have children. Incompatibilities in blood types and rhesus factor can lead to complications during pregnancy, such as hemolytic disease of the newborn. Consulting with a healthcare provider before starting a family can help prevent potential risk of having a child with risk of hemolytic disease of the newborn. Such children usually die shortly after birth. Note that rhesus incompatibility can cause recurrent miscarriage. 5. Chronic illnesses. Chronic diseases are long-term medical conditions that require ongoing management. Being aware of each other's chronic health conditions can help couples provide better support and care for each other. Examples of such medical conditions are diabetes, hypertension, asthma. 6. Allergies. This is crucial to ensure a safe and supportive home environment. From food allergies to environmental triggers, knowledge of these issues allows couples to adapt their lifestyle and make their home a sanctuary. Conclusion. It is crucial to approach premarital health screening without judgment or fear. The goal is not to place blame but to face potential health challenges together as a team. Remember that knowledge is power, and by understanding each other's health status, couples can work towards building a strong foundation for a happy and fulfilling life together. Note that it is not about avoiding marriage due to potential health issues but about facing them together as a united team. Seeking professional medical advice and fostering an environment of love and empathy will undoubtedly lead to a fulfilling and enduring marriage. While love remains the cornerstone of any successful marriage, the importance of premarital medical testing cannot be understated. This practice empowers couples to approach their union with knowledge and understanding, enabling them to navigate potential health challenges together. By embracing the concept of medical testing for marriage, we move towards creating a society that values the well-being of individuals and prioritizes the health of future generations. Please subscribe to our channel so that you can be notified when we release the next video. Note that knowledge is advancing by the day and we will like to always post an update on new advances on how to stay healthy. You can contact us via the link in the description below for any medical inquiry. You are watching Zoom Hospital channel and listening to work of Dr. Criordi.